am incredibly proud of the impact our philanthropy work at SCL Health continues to have across the regions we serve. As a nonprofit health system, the dollars raised by our foundations enable us to support critical capital needs, provide resources for our associates, and ultimately support programs and services that our patients and communities need. This work and the impact it has is truly an expression of our mission, and it advances the legacy of our founders, the Sisters of Charity of Leavenworth.
Philanthropy looks a little bit different at SCL Health because we are so community-centric. That's where we focus our philanthropy on. And to do that, we have to lean into the community and we have to understand what their needs are. What are our patients' needs? And that looks different in each of the regions that we serve. And so it's really about building partnerships, listening, and then coming together to create that support and that momentum forward.
The Major Gifts program is really a matchmaking enterprise. It allows us to connect with donors. That might be a community leader, a retired physician, a longtime associate, or maybe a grateful patient, and allows them to get to know us in the areas of need that we have, and helps put together the gift of a lifetime for a donor to support an area of greatest need at one of our care sites. A great example of the Major Gift program is the Rayner Chair in Cardiovascular Innovation. Through this effort, we raised over $1 million to establish the first ever endowed chair position, and it recognizes a tremendous leader and will drive excellence and innovation in this very important service line.
Cardiac surgery started with Dr. Rayner, who, when he finished his thoracic training at the University of Colorado, moved to St. Joe's and started heart surgery here when heart surgery kind of hadn't existed before. Dr. Rayner was a mentor to me and helped me along in my career so much. He taught me that you need to be involved. The hospital is living and breathing just the same as you and I are, and it needs to be taken care of.
We are developing a cardiovascular center of excellence here at the National Jewish Health St. Joseph Hospital campus. This really involves multiple hospitals across the Front Range within the SCL Health system, but really our goal is to be the best in the region and be on the national map.
Doctors, nurses, advanced practitioners, if they have a project, whether it's quality improvement or bringing something new or different or education, we now have a fund to be able to go and help support whatever anybody wants to do. That's the innovation.
What I would tell a donor considering a major gift is that it's going to be a rewarding experience for you as well as for us. So you're going to get to know the people and the programs that you're supporting, and we're going to really benefit and drive excellence going into the future.
Grants are an incredibly important part of the philanthropy function at SCL Health. Our most successful grants are the ones where we really partner with our community to develop a new strategy, a new idea, a new way of delivering care, or a new way of impacting the health in our communities.
We have worked over the last 10 years with SCL Health in Montana on everything from building cancer centers in Butte, building the new cath lab, to even improving how cancer care is being delivered.
The dual cath lab is a great project that we have starting at St. James. Having two cath labs will allow us more access to our patients who come into our emergency room.
We're able to keep up with the latest equipment and supplies and procedures that we need to be providing the highest level of procedures so that we can have the highest level of outcomes.
At the Helmsley Charitable Trust, we believe in improving rural health care.
Telemedicine allows us the opportunity to let sick patients stay home and keep them out of the waiting room.
It's meeting the patient where they're wanting to be met, and this breaks down barriers, and especially here, barriers of travel in order to complete their visit and get timely follow-up and care.
I have 3 boys that we take advantage of the services the telemed with. They've always been really helpful to me and very quick to respond, and they listen very carefully to anything I say. We have a long trip from Cody to Billings. It's about 120 miles to come up here, so needing quite a bit of a day to do the travel, but the largest concern was the weather. In the winter, it isn't very good. Probably not canceling appointments near as much. We're able to stay on schedule and do things, and it's been wonderful for us.
It's so important to grow your community hospital, give them the best and latest and newest technologies available, because it's all going to pay dividends back into the community.
Our philanthropy efforts truly require a village of compassionate leaders who want to make a difference in their communities. I want to express my heartfelt gratitude to our foundation teams, partner organizations, and especially all who donate their time and dollars to our efforts. Our commitment to you is to be good stewards of your gifts and to ensure they continue to make the greatest possible impact in our communities.
Our donors and foundations are invaluable to us at SCL Health. They really help us expand our mission to all the communities that we serve. I would tell someone that's interested in getting involved is to call your foundation, find out what we're up to, attend an event, but really lean in with us. Get connected with one of our members from the foundation team and understand what we're doing, what our mission is all about.